Ardina, you're on.
And hello out there, folks. This is our last show of 2023. I'm Ardina Stewart, along with Charlie Stern, Peter Moses, and our guest today is Danielle Butin, who has been on the show before many years ago, but Danielle comes back with a lot of updated information. And Danielle, I gotta say, it's a privilege to be able to end our show notes of 2023 with you. Danielle is the CEO and the founder of Afya. And forgive me, because Afya stands for, you tell us what it stands for, Danielle.
Afya stands for health in the Kiswahili language.
Okay, so for health. And Danielle, along with a bunch of volunteers, is responsible for gathering medical equipment from donors and sending it to countries that need it. And she's always sent to the Caribbean, she's always sent to Africa. But today, we're going to talk about the medical equipment that she is sending to the Middle East, which is in dire need, and the logistics of getting that medical equipment there. So with that, Danielle, I guess you can tell us what's going on now.
Well, so at baseline, what Afya does is we rescue medical supplies that would have otherwise been discarded. We are the only nation in the world that when a patient is exposed to a medical supply in their room, in the emergency room, in the OR, and it's not contaminated, it has to be thrown away. So we're talking about billions of dollars worth of medical supplies that could be rescued and repurposed for very good use. So we are looking at millions of pounds of donations from hospitals in New York City and the greater New York area, and it's remarkable. Comes to our warehouse, thousands of volunteers are involved in sorting, preparing, and then we've helped 80 nations, and we're very involved in New York State since COVID.
And the warehouse is where, Danielle?
It's in Yonkers.
There you go. It's a Westchester story.
That's right. The YO.
Yes, and so we are proud to be in the city of Yonkers, and so that's at baseline. And so what we do is we do two things very well. I think we respond to disasters and we build existing health systems to become stronger and better able to deliver care through the use of supplies. And the Afya model is predicated on ask people in literally the trenches, and right now it is, what they need and show up with those supplies. Just because I have 65 new microbiology microscopes doesn't mean that our partner is going to get all of those microscopes. They have to ask for it and need it in order for us to respond in kind. We feel very strongly about this as a governing principle of the work we do.
Let me ask you a question. Do you ever partner with organizations that have adjacent goals? Like, have you ever partnered with AmeriCares, because they ship tons and tons of different things around the world? Do you partner with any of these other care organizations?
We do, and AmeriCares is fabulous, and they will often send folks looking to donate their end-of-life supplies to us. We cross-pollinate and cross-reference all the time. This kind of work is way too hard and complicated for people to covet. This is not the place to covet. And so we've done some amazing work together. I'm a big fan of AmeriCares.
How about Doctors Without Borders?
Doctors Without Borders can afford to purchase their own supplies. We are the answer for organizations that do not have big operating budgets and they want to deliver really good care. And we do not normally send in supplies with aid groups. Our model is predicated on supporting the healthcare system that remains. So we want to strengthen the system for providers on the ground so they'll stay. Part of what happens in Africa and the Caribbean is there's this huge exodus of brilliantly, beautifully trained professionals, but if they don't have the supplies they need to practice their trade, they're going to leave. So we use these opportunities to give people what they need so they deliver better care and they're more likely to stay in the site where they're currently working.
This is absolutely incredible. You know, you sound to me like one of these people that shows up on CNN Heroes and has an amazing idea about how to fix the world's most complicated social problems. So I want to talk about the supply side and the demand side. On the supply side, I read on your website at some point, you have a background working in hospitals, and you found yourself in the basement of hospitals. And I am in technology, and I've also been in those weird corners underneath the hospital where there's supplies piled up for yards and yards and yards, and you're like, what is all this stuff doing here?
Right.
So tell us how you got the idea to do this.
So I work in healthcare and I'm very much aware of the rules that govern practice. And before starting Afya, I was working in managed care and I know the practice guidelines. So I was really interested in learning about what it actually looks like. So uninvited, I walked through the tunnels of the biggest hospitals in New York. And there, the fabulous men, most of it is men working in the tunnels. So many are from the Caribbean. And one, my favorite was one screaming at me, lady, what are you doing in the garbage? I wasn't in the bloodborne garbage, right? I wasn't in that room of the garbage. I was in the tunnels where there were stretchers and there were laundry bins of like gauze filled to the top of it. And that's where I went rummaging. I mean, my needs assessment was I need to get into the waste tunnels and take a real peek at what's going on here.
Danielle, why do those places have tons and tons of excess stuff?
If you were going to have your elbows scoped, there would be medical supplies in the OR to work on. That field would be contaminated with fluid, blood. The back table of the OR has what if supplies. What if you need more suturing, more flushing, more compression with gauze? And if you don't use those supplies because they were in the room with you, they have to be discarded.
Wow.
This is a regulatory issue.
Yes.
By the way, is this the way other countries do it, or is this
No.
specific to the United States?
Specific to the United States.
Wow. Well,
Okay,
we also
so let
have
me ask you a question. So the back table of the OR had a pile of things that didn't get used because it was a routine procedure, and so the what ifs didn't occur. And at some point there was a regulatory decision. I don't know if it's policy or you're talking about federal regulation or state regulation. But there's a federal regulation that said if it was in the room, it goes into a pile in the basement and get it out of here.
It becomes a medical waste because it has been exposed to the patient's medical field and it could have secondary infectivity.
And is that a true? Is it true?
I'm going to give you the comparison story. I don't believe that at all, but
Right.
that's my premise. I was in an OR many years ago in East Africa. They brought in a woman for an emergency cesarean section. They opened her, and then the doctor said, "Oh my God, we don't have sutures to close." And I said, "How could you open a woman's body if you don't have sutures to close?" And he took a 4x4 piece of gauze and started pulling strings, putting it through a sewing needle. And that was as good as he could come up with. So when people say to me, how do you know that it's not damaging? I cannot for the rest of my life let go of that story and thinking about all of these sutures that are being just thrown away on back tables everywhere because it's required. It is unimaginable to me that we can't just rescue, organize it, and move it somewhere else as opposed to adding to incineration.
Right. And you're also talking about a really serious asymmetry in need, right? So the doctor who has to turn gauze into suture is a long way from the doctor whose OR had a table of unused stuff that had to be discarded because of a federal law. So let's talk about the demand side of this since you gave us one example. What kinds of places are these supplies that you gather? Where are they going, Danielle? Like, give us a picture of your customers, your end customers.
Okay, so we have been involved in Ukraine and the Ukraine war since the beginning of it. We are working with the biggest medical centers in Kyiv. We are working with the medical front line with the medics. We are working with rehab providers. President Zelensky's wife is trying to now establish a 500-bed rehab unit for wounded women soldiers so they can rehabilitate with their children in the same facility. I mean, these are the projects that we're getting and that we are finding ways to answer. I mean, this is far more cost effective to send our supplies and to go to market and procure them. And so we are finding ways to match a myriad of needs that have come from Ukraine. We've sent almost $5 million worth of supplies there. Recently, a colleague and I went to St. Lucia, and we are doing more and more in the Caribbean these days. And we did a site visit at the level 1 trauma clinic in St. Lucia. And I said to the nurse, show me your trauma supplies. And she pulled out a defibrillator that was rusting and oozing, and it literally had like red rust around the edges of it. And she said, it hasn't worked in 10 years. I said, so what happens on this island when someone goes into cardiac arrest or they need to be defibrillated? She said, we only have CPR. That's all we've got. And so she showed me IV poles in the recovery room that were held together literally by 8 Band-Aids. They were just like overlapping Band-Aids, or else the whole thing would crack in half and fall over. And I kept saying to her, I am promising you we are going to respond and help you. You just have to like take down the covers with me and show me the truth of this clinic so that we can actually respond to you. But it was very interesting. She said, I can't tell you how many people come here and say, let me see how bad it is. And then they do nothing, which is tragedy tourism is a brutal, painful reality on the recipient end for the people who are being visited. And I had to promise her at least 15 times, you have my word. I don't run this organization so that we'll come and visit and do nothing. And within weeks, we got them an enormous shipment, a new defibrillator that we made sure was working in good working order, patient exam tables, you name it. But that clinic is a different clinic now because of that one visit.
Wow. I want to. You were talking about administering to different countries. Now you are sending equipment to Gaza and to Israel.
Well, we're sending to Israel. Gaza is impossibly challenging to find our way through right now, and we're still trying.
Hey, Danielle, could you just tip your laptop up a little so we can see you better?
Yeah,
Perfect. Thank you.
What has been the obstacle? I mean, I guess I'm kind of overthinking the obvious. But what has been the obstacles of getting equipment into Gaza?
Hamas runs the Ministry of Health. Hamas is in the hospitals. So what this means is, and we don't ship supplies to terrorist organizations. We sent supplies into Syria years ago through the IDF so they could get it when Assad was blowing up Syria, so they could get it into southern Syria and we could open a labor and delivery ward. But we didn't send it to the government that was destroying in the interior of the medical structure. We sent it in a way that we knew it would get into the hands of people that could create a labor and delivery ward. Here, we are working with Israel. On October 7th, the atrocities that have followed have just been horrific. And we started to work with the health ministry in Israel and the JDC, a long-standing partner. And I have to say this is a very complicated war to respond to because Israel is not a resource poor nation, and they are they have centers of excellence in medicine, and technically they shouldn't need our help, but during this time they need our help. And so we have sent over $1 million in supplies. We have a very carefully curated list from them. We have sent these high-tech stretchers so they can move people on rugged ground. We have sent monitors and operating room equipment, and they're asking for 1,000 plus of advanced life-saving bags so that kibbutzes and municipalities can be in a state of preparedness when medical needs or traumas occur, and they can be responsive. And that's what we're doing. We are following the list and we are getting our supplies in. And at the beginning of this war, so many well-intended people were just throwing stuff on cargo planes. I mean, military equipment and healthcare supplies and humanitarian supplies. And most of this stuff is probably still sitting in a warehouse because to clear customs at Ben Gurion Airport, they are precise, and they deserve to be precise around how they're going to practice medicine and what they need. And so I'm not convinced that most of the stuff has even gotten through, but we're very fortunate that our supplies have all cleared. They go to Sheba Medical Center and they distribute to the field as needed. Gaza, we have tried working with an organization that we responded to the Beirut bombing years ago in Lebanon with, They are having a very hard time getting the medical supplies in. And we haven't uncovered the right partner yet, because we're not sending medical supplies to Hamas, and we want to support Palestinian healthcare providers, but it's very hard to get to the right people and to get your stuff through the corridors
Let me
that are
ask you
opening for
something.
aid delivery.
Right.
Well, your organization has been in business how many years?
16.
All right. Is your mission more difficult depending who the president of the United States is?
Yes.
Good
Yes.
question, Peter. That's a great
Yes.
question.
I mean, when the legislation,
Great
look,
question.
when Roe versus Wade was overturned, we were being asked for help by women's health groups all over the country. And there's only so much that we can do in
What
that
I mean is
space.
internationally, when Trump was president versus Biden versus Obama, is your job made more difficult by the politics of this country and the fact that the government under Trump looks inward and not outward, whereas the governments of Democratic presidents seem to be looking outward and inward at the same time?
Yes, yes. And funding follows, look, aid follows funding. That's the bottom line. So the sites that we support and we work with can be in far graver shape if the funding doesn't support the work that has already been going on for years. Yes.
Do you get financial support from governments?
No.
Where does your financial support derive from?
We get funding from New York State, from the Department of Health. We are funded to show up for New York, and we do everything from homeless shelters to senior visiting programs. They all need supplies, and we can serve as a safety net for them. Our funding comes from corporations, individual donors, big foundations. Um,
And
it comes from that
if
layer.
somebody wants to make a donation, there's a way to do it, right? You have a website.
Yes, yes, AfyaFoundation.org. And I just
Spell,
published a
spell it.
book,
Spell Afya
A
Foundation.
AF as in Frank, YA Foundation.org.
Okay.
And I just published a book, which can be also purchased on
Yes.
the website. It's called Wild Hope Now, and it chronicles the many exquisite stories of finding light in darkness. And I think it's a very moving journey that people travel on with me through the stories that we've experienced in those
Do you
16
do you have
years.
a guiding principle that backs up all the things that you've been doing for the duration of your business?
That's such a good question, Peter. I think I'm a big believer that action is the antidote for trauma, and people just have to do something. So I'm a big believer. I mean, we have been pretty rogue at times. We have found nimble, creative ways of getting in. I mean, during COVID, when we wanted to get PPE to the ICUs and the ERs, we literally walked up to the door and screamed for the staff to come to the truck and carry it in. We find ways to do something. The fact that we were able to get our donated medical supplies cleared in Israel is a testament to how fierce and tenacious we are with how we believe that we can do something.
I don't want to get in your way, I'll tell you that much.
Have
I'd be
you
very
been
kind to you, Peter.
speaking of logistics, Danielle? Have you been impacted by shipping at all? By I take it that you use cargo planes as opposed to ships.
Well, we use all, and yes, it's become more expensive, more complicated. Shipping lanes are more congested. Yes, we're facing all of it, and we're doing some really creative work. And one example is the Caribbean. JetBlue is one of our great partners in helping us to make a difference in the Caribbean, and so we find ways to partner that everyone has everyone has something to offer, right? We all have something we can offer. Afya has supplies, but everyone has something they can offer people they don't know who need their help.
What's Afya's greatest need? Pardon me, greatest need right now?
We want to build, well, it's always funding for every non-for-profit. So if people at the end of the year would like to make a donation, that is always transformative and vitally important for us. And I think the other piece is we would love to be involved with more corporations in Westchester County. We have big sorting events. Regeneron and MasterCard are partners of ours, and hundreds of their employees are volunteering and giving back and sorting and making a difference. And it's
What's
fantastic.
I think I know what it is, but what's a sorting event?
It's when people come to the warehouse or we bring the supplies to the corporate site. And literally, the way we get supplies from hospitals, it looks like a Halloween bag. It is a little of everything, and we will never send our supplies like that to sites in need. So if there's 4x4 gauze, this box is only 4x4 gauze, but that means that we need thousands of people to help us sort through the volume of inventory. And what I really love about this is you don't need to be a surgeon to save someone's life. You come to Afya, you get us together so that we can ship what's being asked for. You touch someone's life, you're never going to know. Like, you change the story.
What is the number one most requested item from
Wound
the end
care.
users?
Wound care. Constantly, it's wound care.
That's why you keep talking about gauze.
Yeah, it's always wound care. Because unless you have sophisticated wound care in sites that we're helping, people can become septic.
Yeah.
And it starts
So
with
we're
the
talking
wound.
about we're talking about war zones or places where there just isn't enough health care to begin with. And
Right.
so how much of your work is domestic and how much of it is outside the United States?
I'd say we're a pretty good split. We're a pretty good split. And one of the things that we're also doing is we're working with Title I school nurses in Westchester. So we're going to expand this in 2024, where some school nurses don't have privacy screens. So that when children are sick, they have to find a little place to isolate them, but they don't have refrigerators for meds. And they don't have a nebulizer to send home with a family that's not documented. And all of these layers are elements that we can respond to. So we really see the school nurses in these communities where there's a bigger rate of poverty as an opportunity to go in and be their safety net as well, because these nurses are the pediatrician, basically.
I wonder why the hospitals are sort of putting out so much, to what to them is debris and to you is like gold. So why is that? I mean, you run a hospital, one of these big hospitals in New York, like you're talking about. I mean, they have pretty good record keeping. They have very sophisticated information systems.
Mm-hmm.
Why can't their supply chains be more efficient?
They've become far more efficient since COVID. Far, far more. I think COVID, for every healthcare system in the world, shook them at their core. And I think now they are far more efficient. We're seeing changes in how our supplies are, the volume of supplies. There were more before COVID in terms of there were more. And now what we're seeing is we're just spreading because they're more attentive at this point to the volume and aware of it. And now what we're doing to make up for that is we're just adding more hospitals to our donor network, and then that spreads it out for us.
And my last question is, when you get the call from somebody in another part of the world where there's a war going on, what is that phone call like? Is it come in the middle of the night because they're on the opposite side of the globe? Is it a person, screaming at you from a telephone in an operating room? Or is it a high-level government official saying, we're dying over here, what can you send us? I'm just trying to understand what that sounds like.
It's an interesting...
Or is there a big intermediary network of people by the time the court request gets to you? I don't know how it works.
We usually get the call. With Ukraine, one of our volunteers is, we adore her. She's been a long-term volunteer with us. She's from Ukraine. She connected us to Kyiv's medical center, the primary medical center that does a lot of medical school training as well. And the medical director got on the phone with us weeks before the war broke out. They started to see tanks, Russian tanks coming in. And he said, I'm telling you right now what my list is. I know what I need. I'm going to need amputation kits. I'm going to need chemical respirator masks. I mean, his list was, I'm going to need medical tourniquets.
But
And
this person's a doctor?
yes, and he knew what was coming. He knew what he was
Okay.
going to need.
So
And the
he's pretty
volume
right.
was enormous.
Right. But he's somebody who's like in the medical organization, not a government employee?
No. The government employees they're too removed from the medical front line. So our goal is to speak to the doctor or the nurse running the show so that they can get us a list as fast as possible, and that's what we respond to.
Frontline workers, in other words.
Frontline work.
Yes. We need the clinicians on the ground.
Okay.
This probably makes it a tight, efficient transaction because you eliminate the middle guy. You just go right directly to the source.
Danielle, you're doing some unbelievable work, something I did not know about. I didn't know that was going on in Westchester either. So this was an eye-opener.
Come visit us.
Yeah, we'd like to go and check it out. Absolutely. Thank you for coming on here, Danielle.
Thank you.
Peter, Ardina, you want to sign us off today?
Let Peter do it.
No, I'm
You
going
haven't done it in a while.
Peter, you're on, Pete.
Okay, this has been 914 Wired. This is our last broadcast for the year 2023.
Which I would just like to mention, it's been a big 23 for us.
It has been.
We started on WVOX, the station got sold, they discontinued all of their local programming, and this show has always been about talking about what's going on right here in Westchester, and over a period of a couple of days, we moved it over to a podcast, and now we're starting to see an uptick, and we're getting more people listening than we ever did on WVOX.
And Charlie's most responsible for moving us to a podcast, and Ardina has always picked up the baton and gotten us our myriad of guests. So
Yes.
I wish all of you a happy new year, and I hope that anyone who's watching this remembers us for next year, because we want to build our audience. So talk about us if you like to. Talk about us even if you don't like to. Have a great rest of the year.
In the podcasting world, Peter, we say follow, like, and subscribe. That's what
I have to learn the nomenclature. I'm a 67-year-old old man, so
with the lingo. Yeah, but you're on a young platform. So
yes.
Thanks, everybody. Thank you, Danielle.
Bye.
Thank you.
Thank you, Danielle.